Are you like most busy people, stressed and inundated with health advice? This overwhelm is not helping your health. You see, one day I woke up in severe pain and I could not walk. I was dragging myself around the house in my office chair with wheels. I tried Tylenol, the pain didn't go away. I tried Motrin, the pain didn't go away either. I then remembered that an 80-year-old cardiologist had told me about turmeric. I rushed to the store and bought a turmeric supplement. After taking only one capsule, about 1 hour later, I was able to walk again, pain-free. This miraculous experience made me a firm believer in quality, holistic remedies. I am Dr. Adeola, the body activator. That was me, a nurse, a pharmacist, and a public health professional. I didn't know that I was suffering from inflammation despite all my years of education. Now, I have been able to get to the root cause of my health challenges, and I feel great and full of energy. I don't want you to learn the hard way like I did. So, I created the Wellness Search podcast to share simple, actionable changes that you can make to activate your body to heal naturally today. Here, we will have conversations about food, fitness, mental health, and all that is in between. Now, let's get started. Hello, and welcome to the Wellness Search podcast. Today, I have with me Dr. Holmes. Dr. Holmes is into neurofeedback, and I met her at a Women Network event, which is like a networking event for like women. And she told me she did neurofeedback, and I'm like, what is that? And she told me how she uses neurofeedback to help reset people's mental health. And I'm like, whoa, I'm so intrigued. Can you do it for weight loss? She was like, I don't know. And anyway, so today I brought on Dr. Holmes to talk to us. Dr. Candace Holmes to talk to us about using neurofeedback, right, to help with sleep. And we know that sleep plays different roles in our lives. So before she goes on to talk about all that, I'd like her to introduce herself to you.
Sure. Thank you so much for that wonderful introduction. I appreciate it. I am a mother, first of all, a divorced mom of two beautiful daughters. And one of them my oldest was diagnosed with ADHD years ago. She was 7 and she was struggling in school. She lacked focus and attention. It was taking about 5 hours a night to do homework. She was socially awkward. Honestly, it was a nightmare. When she was diagnosed, I'd already been divorced for 3 years. So it was all on me. I was so thankful that her younger sister was gifted and accelerated, and she didn't need as much as my attention because I didn't have any to give. So years went by and I went through one of my magazines. My doctorate is in chiropractic. And there was an ad there that said, drug-free therapy, non-invasive, results can last up to 30 years, ADHD, anxiety, depression. And just like you said, when I mentioned to you what neurofeedback is, I said, what is that? And so that's how I came into this mental health space. I did research on it and found out that BrainCore therapy is co-founded by one of my former chiropractic professors who was trying to find a solution for his nephew who has autism. So I knew this had to be something because that doctor does not go gently into the good night unless it's something that is really backed by research and science. And so that's how I found about neurofeedback therapy. That's how I got trained in and certified and bought the system home, honestly, just for my daughter. And she had such a fantastic transformation after going through my program that I just wanted to make sure I could educate others so they don't suffer necessarily.
Wow, that's just amazing. So Dr. Candace Holmes is a chiropractor by profession, and she's into the mental health space. Who knew a chiropractor could be into the mental health space, right? I was just totally blown away. I kept sending her text messages. I'm like, tell me again.
Yes.
Tell me again.
Yeah,
and like, what's wrong with this weirdo?
My daughter is now 19. She was struggling so much in school. I didn't think she was going to go to college, but she is finishing her first semester at Savannah State University. She got a scholarship. She did not have to take her pre-cal final. And because her average was so high, and I said, I kept telling you have a strong brain. She said, that's what my professor said. I said, I've been telling you this for all your life. You have a strong brain. But sometimes the brains get dysregulated and they don't function as we need them to. And so that's what I'm happy to just let people know. There are solutions out there.
Perfect.
And that's how I ended up in the mental health space. She used to apologize to me for how she was. And I said, sweetie, I said, do you realize that if this didn't happen to you, if you didn't have this difference, I wouldn't have known about this therapy. I wouldn't have been able to help you and other people who help others. I mean, it's just, it was destined. It was destined.
Wow. All righty. So we've been hearing neurofeedback. So please, what is neurofeedback?
Sure. So neurofeedback is a therapy. It is a sophisticated form of biofeedback. Some people have heard of that word before. And what it works to do is to help a brain regulate itself. So essentially to retrain. So the brain functions in different modes. And typically when it functions well, it goes through all the modes easily, depending upon what it is that you're doing. So the part of the brain that you use to write your name is different from the part that you're using for calculus and physics. When the brain is stuck in one mode over the other, that's when you start having the symptoms of, say, like conditions like anxiety or depression or insomnia or PTSD or many others. Some people have suffered from concussions. They've had traumatic brain injuries. Everything begins in the brain. So, as you know, the brain controls everything. That's why it was so easy to implement this therapy into my practice, because as a chiropractor, we focus on the nervous system. The main components of the nervous system are the brain and the spinal cord. So it's like, oh, this is the space. So once everything in your brain is functioning well, then you're able to accomplish the tasks that most people are able to accomplish well and easily.
Perfect. Okay. All right. So that's neurofeedback.
Yes.
And so tell us a little, because I think it has to do with like wires, right? It's like putting wires to the brain or something like that.
So your brain has frequencies. The frequencies are always coming off your brain. You just don't see them. So what I do is I have an interview, a consultation with potential prospects or patients, because not everybody is a candidate for this therapy. Let me say that too. Once I determine they are a candidate, then they will come in and get what's called a brain mapping done. It's called a QEEG brain mapping. Big words, people, that's what it is. And so you wear a cap that has sensors on it. Oh, you can't see it. So it's like a swimming cap that has sensors on it. And there's some gel that's placed in some of the sensors, and it's connected to a machine. And it takes about 45 minutes to an hour or so. And those brain waves are recorded. So it doesn't hurt. There's no shocks. People ask me, are you going to shock me? No, you're going to shock my child? No, I wouldn't do that with my own child. No shocking. And they also asked if they had to ingest anything. No, I don't. No, non-invasive. So it doesn't hurt. You don't have to drink anything. I'm not going to ingest, make you do anything that breaks the skin. No. And so after the mapping is done, then a report comes out, and my patients come back on another day, and I go over the report and I show them how the brain is functioning. So the brain mapping is not a diagnostic tool. I can't get the report and say, hey, you have insomnia, you have ADHD, you have depression, you have anxiety. I can say, based upon this report, this is how your brain is functioning, and this is how it's functioning well and how it's not functioning so well. We call that dysregulation. And so then from the report, there are protocols that are suggested, and we either go with that protocol or I, use my expertise to see if that protocol will work the best for you, because sometimes it doesn't. And then we go from there.
Okay. So based on that, all those protocols, right?
Yes.
What can neurofeedback be used for? What can you use it to treat?
Sure. So there are many different conditions, mental health challenges like focus, attention, if you're not sleeping well, if you have traumatic events from childhood or just period that you've been through that are on constant loops in your brain and are preventing you from sleeping well. There are so many areas. I have some patients that come to me also if they don't have conditions that have been diagnosed. You don't need to have a diagnosis to see me. So typically, when you're young, your parents notice if something's a little more challenging for you to grasp concepts, or just sometimes there are behavior issues, there's anger sometimes, There can be some anxious thoughts that keep coming through your head. So there are quite a few. I use neurofeedback on myself to help decrease stress levels. So there are executives who come to see me who want to make sure their brain stays sharp and efficient because they don't want to retire at 60 years old, or what, I don't even know what the number is, 65. I told people I plan to always, I don't say never retire, but I plan to always keep my brain sharp and I'm going to be doing some things throughout life. My goal is to live to be 100 and more and spry. Then say, is that Dr. Holmes coming around the corner on two wheels? Beep, beep. Yep, that's me. Hey, that's what I plan on. That's my outlook. So there was a Super Bowl a few years ago where both the quarterbacks used neurofeedback because, after 30, you're considered to be old, quote unquote. You can't see me do the quote unquote in any professional sport. And so those quarterbacks knew that in order to make sure they remembered all those plays and that they kept everything orderly in their brains, that this was the way to do that would affect their game in a positive way.
Perfect. So you were talking about your daughter, right? And autism and all that. I'm just wondering, how long does it take for neurofeedback to work?
Sure. So of course that varies from person to person. There are some conditions that the brain takes a little longer to process the information. So typically about 15 to 20 sessions or so. The sessions are 30 minutes each, 30 minutes long. And what the session looks like is you're watching something on a device. So a laptop, typically it could be a tablet, for 30 minutes twice a day. In my office, that's my protocol. What you're watching is something on a streaming device. So all the ones that Disney Plus, Netflix, Hulu, all those. When you're connected to that computer in that streaming device, when your brain is in the area that we're trying to help, when it's in the frequency that we want it to be in, you'll see what you're watching nice and brightly and you'll hear it well. When the brain starts going to that dysfunctional pattern where we don't want it to be, then the screen will start to fade and you won't hear it as well. And that's a signal to the brain, hey, get back to where you're supposed to be. It's essentially, that's where the neuroplasticity comes in. Your brain is able to learn new ways of being. And anything you do over and over again, you get better at. I was a softball pitcher in high school, through grade school through high school, and also played basketball. So the more I had pitching lessons, the more I practiced my free throws, the more accurate I became. So it's the same concept. You're just trying to get your brain to know where it's supposed to be at certain times so that it can function and help you complete the task that you're trying to complete.
Wow. So you said about 20 sessions, right?
So there are different reasons why it could take longer. There may be hormonal issues. There may be dietary concerns. Your body has to be ready for it. It's just like you won't have someone who's overweight perform a marathon,
Yes.
without training. I mean, it can be done. However, it takes training. And that's exactly what it's training your brain. So you can call it exercise for the brain, essentially. So that's the average person, could be about 15 to 20 sessions. Those people who have been diagnosed with autism and Asperger's, Parkinson's, and some other conditions can take 2 to 3 to 4 times as long. So it just depends. Not everyone is the same. Not every brain is the same.
Okay. All right. So from just talking to you, right, and you were telling me that people get to do this in the comfort of their homes. So people love to watch all those Korean dramas.
There you go.
Binge on. So you get to watch that in the comfort of your home. You put this cap on and the recording device just records, and you get all that feedback from wherever the person is in the world. How cool is that?
The brain mapping is done in an office. That's where you wear the cap. The actual training sessions that are done in your home, you have some sensors that are placed on different areas on your scalp. So the mapping is the first part, and then the training is what you do at home if you're on one of my programs. And that's what I love about it. It's because it's convenient and easy. So there is, with the home unit, there's a device in those sensors. I'll show you, of course, where to place those. They're connected to the machine. And that's where you get to do that at home at least twice a day. Again, in the comfort of your home and the convenience, because not everybody has the same schedule. And I'm located in Georgia, but you don't have to be in Georgia. I have a patient in Maryland, patient in California, patients in Texas. So all over, as long as I can coordinate with some practitioners in your area so that you don't have to fly to see me. Although I've had people offer to do that. I said, I thank you. I appreciate the thought, but I'm not trying to make it inconvenient for anyone. So that's how I'm able to help people nationally.
All righty. So let's get to the nitty gritty. Yes. A lot of people are dealing with trouble with sleep. Okay. Yes. How can you use neurofeedback to improve sleep?
So sleep is a huge issue. So the people used to know that it was 8 hours of sleep that you needed per night is what the average was. That they've even taken that down to 7 now. And of course, it's more for those who are younger because the brain doesn't fully form until you're 25. But typically for those people who are 25 and over, it's at least 7 hours of sleep. Well, I started calculating how many hours of sleep I was getting. I was getting only 6 hours of sleep. And I'm like, okay, well, I have to practice what I preach. So I know what time I need to go to bed, and I have to tell myself, okay, start shutting everything down, put the phone away, turn off the television, get into your routine. It's a huge issue for people. So the way neurofeedback works, like, let me go, I had a patient. She was only sleeping 2 hours a night. 2 hours. I'm like, how are you even here? Because I would be not so great on 2 hours of sleep. And so she started with me in my program, and she went from 2 hours a night to 4 hours a night to 7 hours a night to 9 hours a night. And then she went 11 hours a night. I said, oh my gosh, I just feel like a different person. I said, imagine that. I said, you are not a computer. Your brain needs to reset just like your laptop does, just like your cell phone does. I don't know how many times have you been on your phone, like, why is my phone not working well? And it's slow. Well, when's the last time you actually shut it off? You have to shut off your brain. You have to shut off your body. Your body needs that time to reprocess, to replenish, to repair, and all those reasons that you can think of. That's what the body needs to do when you sleep. And it needs at least 7 hours for those processes to be done efficiently. So that's how neurofeedback can help. She did the program again with sessions, and her brain was rewired. So it knew when to shut down or go dormant, we'll say, and then when to get back up and get back into the swing of life. Wow. Yeah, I feel like a new person. I said, we're
11 hours of sleep.
11. Well, and it's the thing, it's because her body had been deprived for so long. So I've checked in with her every once and again, and now she's at about 8 to 10. So but she says she hits that pillow. She said, Dr. Holmes, I'm out. I said, well, good. As long as you're out and you have some people who don't sleep well because they can't, quote unquote, shut off their brains because they're constantly thinking of things. And so one of the tips that I have for that is to have a journal. It doesn't have to be a fancy journal. It could be a notebook where you're writing down all the things that are going through your mind. I don't know about you, but when I'm taking a shower, that's when everything hits me like, oh, did I call that person? Wasn't I supposed to pay that? Wait a minute, was this tomorrow? What's going on in my child's life? What's the schedule? Yeah. So that's when things hit me. And typically just when you're going to bed, your brain is trying to make sure that you remember all those things. And so that's why people say, I just can't shut my brain off, because it's trying to make sure you remember everything. So if you write it down, when you write it down, then subconsciously your brain will say, oh, wait a minute, I can let that go because it's on that sheet of paper that's right by my bed. So I can just get into that deep level of sleep that you need. Wow. For maximum relaxation and efficiency.
Perfect. I have really enjoyed this. I'm like, maybe I need some neurofeedback to help with sleep.
Listen,
me and 1,000
oh my gosh,
people.
Yes. They're I call them they're positive side effects. So people typically come into me for one or two things, and other positive happenings. I call them positive side effects happen. So it's so fantastic. I just wish I knew about it years ago when my daughter was diagnosed at 7. I didn't learn about it till she was 13. I'm thinking, good Lord, 13 of the longest years of my life, working every day, getting home about 7 and staying up with her till midnight every night. And it didn't have to be that way. And I had to just realize that everything comes to you when it's supposed to. So it's all part of how things work. And it's okay. And it's okay. And let go of the guilt too, because I know as a typically women, as just moms, we have guilt. So we're going to let the guilt go and know that, there are other options out there that don't include medication that work well.
Absolutely. And that's the part I like. The other options out there that don't include medication and work. I'm all for that. All righty. Perfect.
Absolutely.
So we've talked a lot today. I've thoroughly enjoyed the session, learned a lot. What is one thing that you want to make sure that people take away from your conversation today?
Sure. The one thing I want people to take away from the conversation today is that there is hope. There is hope. Life doesn't have to be just as it is right now if it's not so great for you or someone you love. I just remember my ex-husband would try to console me, about, I kept thinking about what did I do wrong for her to have ADHD, and did I, was I not eating right? I had great pregnancies. I was a surrogate twice actually after having my own 2 children, so I'm in perfect health. It just happens, and so typically there's a genetic component to ADHD. I just want you to know that there is hope and there are other options out there available, and people want to help you. I want to help. That's my whole goal, is just to help others so that they aren't suffering, because when you're taking care of or focusing on one child, typically other relationships suffer. It's just the nature of the beast. So if you're able to have harmony and joy and hope in your life, then everything works out pretty well.
That is just beautiful. There is hope, people. All right.
Yes.
You don't have to suffer in silence. So you talked earlier saying that people can get work with you from anywhere in the world. How can they get a hold of you after the show if they're interested in neurofeedback for any aspect of their life?
Sure. I offer complimentary Zoom consultations. And so you can go to my website. It's BrainCore of Duluth.com. So brain core like an apple, CORE, of Duluth is D as in dog, ULUTH.com. And you just click on the button, and I'm here to serve.
Perfect. That's awesome. Thank you so much, Dr. Holmes. I really enjoyed this session, and I'm always trying to add to my repertoire. So
likewise,
drug-free, there's hope.
There is hope. Non-invasive, drug-free, results can last for 30 years. I so thank you so much for inviting me to come on your podcast. I thank you so much. It's been a pleasure.
It has been a pleasure, likewise. All righty, so have a good day.
Thanks, you too.
Guess what? I have a free gift for you. Go to wellnesssearch.com and take the quiz there to find out if you possibly have high blood sugar. Or you can schedule a free call with me where I can share one thing that you can take action on to start feeling your best. If you've enjoyed the show, then follow us and subscribe on Apple Podcasts or Spotify. Information presented here is for educational purposes only, and it is not intended to diagnose or treat any disease. Please do not apply any of the information presented here without first speaking with your primary care provider. With best wishes to see you thrive. Have an awesome week.